Many people have received chemotherapy and gone on to live healthy, productive lives. Chemotherapy is one of the most effective defenses against cancer, so it is a very important part of your treatment plan. Beginning chemotherapy may be stressful for patients and their loved ones. The good news is that you don't have to go through it alone. There is plenty of help available from the treatment team here at McGee.
Everybody at McGee was so helpful and so kind, which makes just this so much more bearable.
This program will answer some of your questions and explain how chemotherapy is provided at McGee Women's Hospital, so you have a general idea of what to expect. However, every patient is different. Your treatment program is carefully tailored to your specific needs and may not be like others that you may hear or read about. If you're interested in learning more, consult reputable organizations you can trust. The McGee Women's Hospital website, UPMC Cancer Centers, and WebMD are all good sources of information. Chemotherapy is the use of drugs or chemicals to treat illness or disease, most often cancer. It may be combined with radiation or surgery. McGee provides chemotherapy for patients with breast, uterine, ovarian, cervical, and other cancers. Many different and powerful drugs and chemicals are used in chemotherapy. Your doctor writes a prescription for the drug or combination of drugs that is appropriate for your needs. The drugs are designed to kill cancer cells. Cells are the tiny building blocks of life. Each cell is unique, so a liver cell is different from a breast cell or a skin cell. Healthy cells grow in predictable ways and die when they no longer serve a purpose. Cancer cells grow very quickly and in unpredictable, uncontrolled ways. Cancer tends to invade other parts of the body. Chemotherapy drugs slow the growth of cancer cells, but also harm other fast-growing ones like healthy cells in the mouth, intestines, skin, hair, and nails. Different types of cancer require different types or combinations of chemotherapy. Your doctor considers the type of cancer, its severity, your age, your general health, and available drugs when writing your prescription. Chemotherapy may be given alone or along with radiation and surgery. Thanks to medical advances, chemotherapy is improving and is much easier to handle than in the past. There are also many ways to ease any side effects that may occur.
Luckily, I had the type of doctor that said to me, Jackie, this is not a death sentence, and I don't want you to look at it that way. And even with the chemo, she said different people react differently to chemo. So just because they may have had a bad experience doesn't mean that you are going to have a bad experience. And so I took that to heart.
Your first chemotherapy visit will probably take 3 to 5 hours, so it's a good idea to bring some reading material, music, or a DVD player to help pass the time. The facility is kept cool, so bring a sweater or light jacket. You will be more comfortable if you eat a light breakfast before you come in. Ask a family member or friend to accompany you to treatment. Since you're not sure how you will react to the drugs, it is important to bring someone who can drive or escort you on public transportation. McGee has a well-equipped cancer center that is designed to make the chemotherapy experience as comfortable as possible.
What they said to me at the beginning is, we won't promise you a symptom-free chemo. We can't do that. But we want to do the best we can to keep your symptoms as limited as possible. And the first round of chemo I had, I was really, really sick. And I thought, oh, I guess this is what chemo is like. This is what it's going to be like. And I went back to my chemo nurse the second treatment, and I said, boy, I was pretty sick. Is that what I'm up against? And she said, no, that's not acceptable, and gave me an anti-nausea drug that just helped me. And so as every time I communicated to her something that I was experiencing, not knowing whether or not anything could be done about it, you know, she was really responsive and helpful, and that part of it I thought was pretty amazing.
There is a lot to accomplish during the first chemotherapy visit. When you arrive for your appointment, check in at the registration desk. Most patients meet with a financial counselor to discuss insurance and to review any out-of-pocket expenses. You will be examined and the doctor will review your treatment plan with you, so it's a good idea to take notes. The number, frequency, and length of chemotherapy visits vary from patient to patient. You should write down any questions you want to ask at these appointments. The team will also discuss possible side effects. You will be asked to sign a consent form before receiving treatment.
Well, I took my family with me, and we took a chart with us, and we recorded, my sister actually recorded everything that took place in our conversations, whether it was the doctor, the oncologist, the mammogram specialist, because there, at times it looked like I was going to get a mastectomy rather than a lumpectomy. And so there was a lot of information thrown at us. Days at McGee, ended into 8-9 hour days. And when you walked away from there, you were drained because you're lucky if you can remember what happened the first hour. So we wrote a lot of things down, and then it was good that I took people with me because then everybody remembered different parts and we all would place it together.
I have it organized in a folder with all my information according to, what I need to address as far as with the doctors and things like that. It's very important to be organized, very important.
Patients should get blood work done and have the results sent to McGee before the first visit. If you use a UPMC or Quest facility, the reports arrive more efficiently. Blood work is done before each chemotherapy session, and the results are analyzed before treatment can begin. If the results are satisfactory, your chemotherapy is mixed in McGee's on-site pharmacy. This takes some time, so please be patient as the process is critically important to your safety. Once your chemotherapy is prepared, you are taken to a bright, cheerful treatment room equipped with a personal television. Most patients receive the drugs intravenously through a vein. Be sure to let the nurse know right away if you feel discomfort while the drug is being injected. You sit comfortably in a recliner chair with an IV bag hanging beside you. Over the next several hours, the bag will slowly add the medicine into your bloodstream. Some patients with gynecological cancer receive intraperitoneal or IP chemotherapy through a surgically implanted port in their abdomen. These patients lie down for treatments. No matter how your chemotherapy is administered, you will be carefully monitored for allergic reactions throughout treatment. McGee's Cancer Center is staffed by experienced oncology nurses who are specially trained in cancer treatment. Please let them know immediately if you experience any itching, scratching, burning, or painful sensations, which may indicate an allergic reaction. During treatment, you can watch television, work on your computer, read, sleep, or simply rest. If your treatment is scheduled over lunchtime, you will be served a light meal. You're also welcome to bring in your own snacks and beverages.
I always brought a chemo buddy. I had a friend for every one of my treatments. And initially, I felt guilty about it. I'd say, why am I, and especially after I got used to it, I'd say, why am I bringing people with me?
That's what I did during chemotherapy. Some people watched TV, some people read books. I prayed.
When your IV bag is empty, the nurses will remove the IV line and place a bandage over the stick point. You will also receive discharge instructions with specific information about what activities and foods to avoid at home. Before you leave, stop at the reception desk and verify the time of your next appointment. After treatment, when you're back at home, please don't feel as though you're on your own. You can always call the McGee Cancer Center for help. If it's after business hours, a doctor is on call. You'll find these and other helpful phone numbers in your discharge packet.
keep in touch with your doctor. Have your doctor explain everything that really, have a breakdown of what's really going on with you in regards to your chemo. Just, in regards to your illness, your diagnosis, whatever. Make sure that you keep a rapport with your doctor.
Whatever my doctor told me to do, I did to the letter. So basically, it's just like listening and getting that great rapport with your doctor. Because I find that if you develop that rapport with your doctor, that makes it a lot easier too. Makes it a lot easier.
During chemotherapy, you want to take very good care of yourself so your body can heal and stave off cancer. While it's a good idea to maintain your normal lifestyle as much as possible, you want to be sure to eat well and get plenty of rest. Eating a balanced diet that includes foods with protein, iron, and vitamins will keep you nourished and help decrease certain side effects. The cancer team can tell you about any specific foods to avoid and suggest cookbooks.
What we learned was that just having a very small plate with a small amount of food on it was much more appealing, and I could get through that. And then over time, I could eat a second helping or more, but that just starting out with small amounts of food when you feel like you don't have an appetite is a lot easier.
In general, it's important to drink plenty of fluids such as water, soup, soda, milk, and decaffeinated coffee or tea. Caffeine is not recommended, and you'll also want to avoid fruit juice for the first few days. If your doctor has not restricted your fluid intake, try to drink at least 6 8-ounce glasses a day. Some people find it easier to sip a little bit throughout the day rather than drinking a whole glass all at once. Don't include alcohol among your liquids unless your doctor gives his or her approval. Alcohol can cause dehydration, irritate your gastrointestinal tract, and affect liver function. Exercise and recreation are recommended during treatment. Keeping physically active helps your body cope with chemotherapy, reduces stress, and can raise your spirits. So walk, swim, bike, or golf as much as you like. Just remember to pace yourself and increase your activity gradually. On days when your energy is low, plan your activities so you get the things done that are most important to you. Try to focus on what you can do rather than on any limitations.
As far as the chemotherapy, it drains you, so you know what I mean. You definitely have to go home and take a rest. And that week that you had the chemotherapy, you need to rest.
I would feel badly, feel like I should be more productive, feel like I should be getting stuff done. And it took me probably 2 months of chemotherapy before I let go of that. And once I did, it was a really good thing.
During chemotherapy, you have to be particularly careful about personal hygiene. Depending upon your prescription, these very strong drugs will remain in your body for 3 to 7 days after treatment. Some people who receive chemotherapy experience fatigue. Sleep and relaxation are very important as they help your body heal and grow stronger. If ever there was a time when you have earned the right to kick back and relax, this is it. If slowing down is difficult for you, try getting a massage or listening to calming music. The healthcare team can teach you muscle relaxation and mental imagery techniques. Meditation, acupuncture, art therapy, aromatherapy, biofeedback, and yoga are other activities that you may find refreshing.
I would go to a yoga class because some days I felt great and some days I felt really tired. So I would go and I would do what I could do. And no matter what I could do, I always felt better when I walked out of the class. And even the days when I said, I feel like crap today and I really don't want to go, I was always glad that I did, even if I didn't do much, because it got me into a different atmosphere. It got me into a different mindset.
Sometimes chemotherapy disrupts sleep. To get a good night's rest, try to go to bed and wake up at fairly regular times and avoid long daytime naps. Establish a nighttime routine such as reading or listening to quiet music. Also, avoid things that contain caffeine like coffee, tea, cola, and chocolate after 5 p.m. Ask your family and friends to help you get your rest. Assure them that they don't have to be afraid to touch or hug you. There's nothing contagious about cancer or chemotherapy.
So it was pretty difficult. And the basic demands of just keeping the house up to date, I relied heavily on my family for that.
And I had to really learn to let go. And whenever friends and family said, Jackie, what can I do for you? I always designated, you know what? You can come run the sweeper for me because dust really bothered me. You can dust for me and bring food.
Chemotherapy affects people in many different ways, so your experience won't be exactly like anyone else's. After all, there are many types and stages of cancer that are treated with a variety of medications. Hair loss is widely associated with chemotherapy, but not all patients experience this. You may gradually lose hair from your head, face, armpits, pubic area, chest, or legs 17 days after treatment. Losing hair is alarming, but it does grow back when your chemotherapy treatments are complete. You might want to consider getting a short haircut early in your treatment so the loss is less noticeable. Also, there are many beautiful turbans, scarves, and hats available. If you plan to use a wig or toupee, do it early in your treatment so you can match your hair color. Your health insurance or the American Cancer Society may even help you pay for it. Chemotherapy drugs can make your skin more sensitive to sunburn, so wear a hat and a PA/BA-free sunscreen when you're outdoors. Avoid tanning booths and sun lamps. Many people experience fatigue and weakness. Sometimes it's caused by the chemotherapy drugs, sometimes by the cancer, and other times by loss of appetite and lack of exercise. Cancer treatment fatigue tends to come on suddenly and is not always relieved by rest. Sometimes the fatigue continues after the treatment is complete. Fatigue can make it difficult to concentrate and stir up your emotions. When you feel exhausted, don't fight it. Rest up and plan your next activities carefully so you get to the most important things first.
It just zapped me. I had no strength whatsoever. I would go from my bedroom down to my family room, bedroom down to my family room on the sofa, and that was the gist of what I could do. I could do nothing.
Felt really terrible for a long time. I'd had a lot of surgery. I, started chemotherapy, and there was a time when I just started feeling better. And I remember the moment, and I turned a corner, and it got easier after that. And so many people that I've talked to that have been through chemotherapy have said that that was their experience as well. So you just have to get to that point where you turn the corner.
Radiation, surgery, or chemotherapy drugs may affect sexual and reproductive function, so you should discuss this with your doctor. Most patients can enjoy the comfort and pleasure of sexual intercourse. However, the stress and fatigue of treatment may make you more tired and less receptive than usual. If it creates a problem for you or your partner, talk with your doctor. People who have received chemotherapy have found it helpful when friends and family offer emotional support throughout the process.
Physically helping is one thing, but mentally, just to let them know that you're there and that you love them and that you're going to be with them through this so they don't feel alone, because some days you can feel very alone.
Hugs, telling somebody you love them, assuring them that whatever, you need, they'll be there for you.
Changes in the menstrual cycle may occur during chemotherapy. Some women stop having periods, some have irregular ones, and others experience heavier or lighter menstrual flow. Older women may experience hot flashes or the early onset of menopause. Despite these changes, it is still possible to become pregnant. Because chemotherapy poses risks to an unborn child, birth control during treatment is strongly recommended. Talk to your doctor about what type of birth control is safe to be used with your cancer and treatment. If you think you may be pregnant, tell your doctor and nurse immediately. Whether or not pregnancy is a concern, you should use condoms during intercourse for a short time after chemotherapy to protect your partner from exposure to the drugs. There are other possible side effects from chemotherapy that the cancer team will discuss with you personally. No two people experience chemotherapy in the same way. No one can tell you what you should be feeling or thinking. Only you know what is right for you. Emotional ups and downs are part of the experience for many men and women. You may feel angry, afraid, or depressed one minute and hopeful, peaceful, or confident the next. Allow yourself to have these mood swings.
You have to go through the really dark moments to know you don't want to live there. You don't want to stay in those places. They're not good places to stay in, but you have to check them out once in a while just to get through them and to have the significant conversations you have to have with your spouses and with your kids. And you have to have a lot of conversations that are not easy. And so to be able to have those and then get through them, I found to be better than feeling like I had to be really positive all the time.
Expressing your thoughts and feelings can help you recognize, accept, and cope with them. A journal or diary may help you sort things through. It is helpful to talk about your feelings with someone you trust, a friend, a family member, healthcare professional, or spiritual advisor. There are also support groups for cancer patients and McGee volunteers who have been through this experience themselves. Even though it may be difficult, try to keep things in perspective. You will have a better experience if you can stay positive and keep an emotional balance.
If you go into it with a good attitude that you're going to beat this and you're going to get through this, then that can really make the difference in your treatment.
That's the problem. A lot of people feel that their life is going to shut down because of this. And, they may diagnose you with certain things, but that doesn't mean that it's the end of the world, and that's the thing that people have to focus on.
Cancer and chemotherapy are a time of change and can be very stressful for you and your loved ones. Try to be clear about when you need rest, peace, and quiet, and when you would like to share in activities. Let others lend a hand, especially with routine household tasks and meal preparation. If your neighbors, community, or church group want to help, accept their offers graciously. Chemotherapy is challenging, but it is the best treatment available for many types of cancer. McGee's program is among the nation's best, so you can be confident that you are in good hands.
Now I feel so great that I can exercise again and not get kicked back, so I work out, and then I don't have to wait for that chemo kickback, right? I can just keep going. I have a long way to go to get my strength back. I was always strong and I liked being strong and healthy, and I have a big road to travel, but I'll get there. I'll get there in as fast as my body will let me get there. And I feel like I'm putting my life back together.
I feel good now. I feel good. It's been a year since I've been off of chemo, and I have my hair back, so I'm very happy about that. And I'm just taking it one day at a time, and I try not to get overwhelmed with every ache or cramp or something that I can't figure out what's wrong. I try to just deal with that, but I just seen my oncologist a few weeks ago, and everything looks good, so I'm really happy to hear that. Good reports.
I feel great now. I feel absolutely great. I feel wonderful. And I feel truly blessed that each day that I wake up, I feel that I am truly blessed to have gone through everything that I've gone through, from my first diagnosis through when I was diagnosed again when my cancer came back in 2008, having to go through more chemo, more surgery, loss of hair, came back, I feel truly, truly blessed.